Good afternoon. Fall is finally upon us. And with all the pumpkin spice and the pumpkins and the holiday festivities, also comes the ugly viruses that are rearing their head. Fall viruses are very common around this time, and I'm sure you must be nervous. You want to know, how can we prepare for it? How can we prevent it in our children? And what do we do? I have all the answers to these questions and more, so stay tuned for the next episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, a show where we encourage you and viewers to send in your questions so that I can answer them in real time. Hi, I'm Dr. Scarlet Constant, the founder of Constant Care Pediatrics, and today I'm going to address your questions concerning fall viruses, common viruses amongst children, and their treatments, management, and more. So please send in your questions, and I will get to them as fast as possible. Looks like we have a question coming in right now. The first question we have is from Angelina. Hi, Dr. Constant. Our daughter, Coco, always gets the common cold sometime between Halloween and Thanksgiving. You can almost set your watch to it. Why is it so prevalent during this time of the year? Well, from Halloween to Thanksgiving, which is, of course, the fall season, the temperature starts to change. And this is a time where a lot of the viruses are a little more active. But more importantly, we start to spend more time indoors than outdoors, such as like in the summertime. So when we're indoors and we're spending a lot of time in closed counters, especially in cold weather climates up in the Northeast and the Midwest, this is when viruses have many more hosts and it's much easier for them to thrive and jump from host to host. And so you start to see more of a spread. Yes, in certain climates where it's a little warmer, we do still spend more time outside. You still have the prevalence of these viruses, and we're traveling, we're interacting more with those that are in endemic parts of the country. And so we still are able to spread the viruses. And this is why we see it more commonly in the fall. So it looks like we have another question coming in. And this question is from Bobby. Hi, Dr. Constant. Every year around this time, I get a cold that keeps me off my feet for 2 to 3 days. And then my kids get it for about a week. How can I help my kids get over it better and faster? Well, Bobby, so, this is common. This is because at your age, and I'm in no way saying that you're an old person, but by your age, you have been introduced to these viruses several times. And each time you're introduced to these viruses, your body builds up more and more immunity. Your antibodies, are stronger and they're more equipped and they're ready to react. So it's only natural that later in life, we react a lot faster and our symptoms last a shorter period of time than our children. Our children are initially being exposed, so they're building up the defenses to fight. These are our memory cells, is what we actually call them. And so the more familiar they are to these viruses, the better memory and the faster they react and the quicker they get over the illness. Now, some ways that you can naturally help your kids get over it faster is, first of all, when you initially see symptoms, start to treat those symptoms as soon as possible. Because not only do you want, there's one part where you want the virus to resolve faster, but the symptoms can still linger even if the virus has resolved. And by that, I mean that the complications that are associated with the virus, such as runny nose, nasal congestion, a cough, maybe you have the cough because you have inflammation in the chest, maybe you still have a headache because you have sinus pressure. Those are things that are unrelated to the actual virus. So just because the virus has resolved does not necessarily mean your symptoms will resolve. So what you can do is get ahead of that by treating those symptoms right away. For example, you could use saline to irrigate the nasal passageways and dilute the congestion, clean out the nose, and therefore relieve a lot of the sinus pressure. You could also prevent postnasal drip, thereby preventing the coughing. You can give antipyretics, meaning Tylenol or Motrin, to relieve the fever, to bring down inflammation, and to decrease the temperature. And that also helps with sinus pressure and headaches. It also helps with your body aches that you might be experiencing. So all of these are symptomatic reliefs that you can work on while your child's body is actually fighting the actual virus. I hope that helps, Bobby. It looks like we have another question coming in. This question is from Kiara. Greetings, Dr. Constant. I'm in a bit of a quandary. I can't really tell the difference between the common cold and the flu. I get what I think is a cold every year with fever, chills, and achy joints. Is it a cold or is it the flu? Well, Kiara, that's a great question, and it's really not that black and white. The flu that we commonly call it the flu is caused by influenza A or influenza B. And yes, it gives you a high fever, body aches, headache, nasal congestion, sometimes coughing. The cold, your common cold caused by many other viruses, can also cause similar symptoms. The only way you would know the difference between the flu and a cold is if you get tested. And if you are tested for the flu and it comes back positive, you know you actually have the flu caused by influenza. Influenza can also cause other symptoms. You can get the flu and have nothing but vomiting and diarrhea. Some people have the flu and they don't have any symptoms except for a very severe headache and neck pain. So the flu presents in many different ways, but the only true way to differentiate between the flu and a common cold is to actually get a test, a rapid test. And that way you know if you have influenza A or influenza B. Okay, if you guys want to send in your questions and you can't remember how, take a look at this video clip.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, so it looks like you guys are still sending in those questions. Here we have a question from Quinn. Hello, Dr. Constant. I'm a well-educated mother of 2 little boys, but I'm getting confused. I keep hearing all these different names for viruses, rhinovirus, enterovirus, and of course, coronavirus. Are they similar? Which ones are the most dangerous? Help me out, please. Yes, Quinn. So, these viruses have been around for decades. And they've been infecting children for decades. But now that we have more sophisticated rapid testing in the offices and hospitals, we're able to actually identify exactly which virus is causing the cold or illness that your child has. And we're able to tell you the name. So now it's quite confusing because you're hearing all of these names that sound new to you, but they've been around forever. So there's rhinovirus, enterovirus, Coxsackie virus, adenovirus, coronavirus, which has been around forever, not to be confused with COVID-19, which is the coronavirus of 2019. So all of these viruses cause different symptoms and they are not similar. Some of them belong to different families, and I really won't get into the microbiology of them, but they do belong to different families, and then those families cause a group of symptoms. So it helps us as physicians identify exactly what type of, or maybe project what type of illness you have. Therefore, we know what to expect and how to treat moving forward, but it doesn't necessarily matter for you as a parent to know exactly which virus your child has, because it ultimately won't change management too much. Like I said, it helps us, understand and know what to expect. As far as the more severe or the most dangerous virus, it varies from person to person. There are some viruses that are quite aggressive, such as the para-influenza virus, which should not be confused with the influenza virus, but the para-influenza virus and metapneumovirus, those are 2 that tend to cause pretty severe respiratory symptoms, especially in children that have a predisposition or predisposing lung conditions such as asthma or chronic lung disease. Sometimes they respond far worse than other children, but overall metapneumovirus and para-influenza virus tend to cause some pretty severe respiratory illnesses. RSV is another one, respiratory syncytial virus. That's a virus that causes very severe respiratory distress, but again, only in a younger age group. RSV in a 2-year-old does not cause the same results in an RSV in a 7-year-old. So these are all things that we have studied in medical school and kind of learned the epidemiology around it and understand how it affects. But overall, I think the best thing to do is when you do get tested, leave the treatment and management to the physician rather than trying to figure out which virus is going to be worse or cause certain symptoms, because overall they cause in general the same type of symptoms. So it looks like we have another question coming in, and it's from Julio. Saludos, Dr. Constant. My wife and I just had our second child 3 months ago. We also have a 3-year-old who goes to daycare. We're very concerned about RSV, especially because of the baby. Are we right to be concerned? What can we do to protect everyone in our household, especially our newborn? Julio, that is a great question, and of course, it is a very legitimate concern. This is RSV season, and it is not rare for your 3-year-old to pick up RSV in daycare. What I would say is that, your child is going to daycare and, they're already there interacting with their friends. I wouldn't say pull them out. But when your child does come home from school before seeing their newborn baby, I would have your child take off their clothes, take a shower, wash up, wash their hands, then change into the clothes that, that they have at home before they see their sibling. I would make sure that, of course, they're gonna wanna play with their sibling and touch their sibling, but maybe just, kiss them on the back of the head or the feet. That's what I always tell my patients, have the older siblings kiss the back, kiss the head, kiss the bottom of the feet, so they're not really getting their secretions on the baby, not playing with the baby's toys or like taking a pacifier. They love to take it and touch it and play with it and then put it in the newborn's mouth, and that is a terrible idea because that's the first way to pass a viral infection to their newborn sibling. In order to protect everybody in the house, of course, get vaccinated for the illnesses that you can prevent. So getting your flu vaccine is important. For mom, when she was pregnant, hopefully she got the RSV vaccine. That is also very helpful because it's protective to the newborn baby as well. And just practicing the common safeguards that we all were reminded of during COVID. Wash your hands, cover your face if your child is coughing, they should not be around the newborn baby so often. I know it's not possible to completely to keep them apart, you don't want to quarantine, but you certainly don't want them coughing near a newborn or rubbing their nose or blowing their nose near the newborn and then touching the newborn. RSV is very, very dangerous in the newborn baby, and it can lead to hospitalization due to respiratory distress. RSV causes very thick secretions, nasal secretions, as well as pulmonary secretions. It also causes a lot of coughing, difficulty breathing, shortness of breath. And so in a newborn baby, these symptoms are very difficult to manage at home, unlike in a toddler where you can actually ameliorate the symptoms by using antitussive medication, decongestants. You can get them to blow their nose. You can do a little bit more in an older child, but in a newborn, it's not so easy. And a lot of times they will end up hospitalized. So you certainly want to take it seriously and be very careful with your child that is in daycare and make sure that you're putting in place all of the preventive measures to prevent them from passing on any type of viral illness to the newborn baby. Good luck. I don't want to scare you, but this is something that is very common and actually personal to me. My 2-year-old actually gave my 6-week-old RSV, and it was a terrifying experience, even though I am well prepared. I've treated RSV many times in my life. At that moment, as a mom, as a postpartum mother, I was terrified and ended up in the emergency room with my 6-week-old. Actually, I believe he was 4 weeks old, not even 6 weeks. He was 4 weeks. And it was quite scary. Thankfully, he wasn't hospitalized and admitted, but he certainly needed to be seen by ER physicians. And this was because his 2-year-old sister had RSV and just, passed it on to him. This is another point that I'd like to make, which I want to remember, is that I'm certain that my daughter gave my son RSV through me taking care of her, wiping her nose, trying to help her, and then also nursing a newborn. I believe that I'm the one that passed it to him. So parents, remember, we are so focused on keeping the little ones away from each other and separating them because we think our toddlers are going to cough on our child or touch them or drool on them. And in reality, we forget that we're the ones that are getting the brunt of all of that. And we need to remember to wash our hands and to change our shirt and to maybe not blow a nose and then touch a baby. So remember as parents to also, sometimes I tell my parents to separate. One parent has the newborn where another parent will have the sick child. So that's some advice that I give you, anecdotal advice. Good luck, take care. So it looks like we have another question from Darcel. Hello, Dr. Constant. We're getting ready to take the kids to get our annual COVID vaccine. My grandmother, who is 85 years old and not in great health currently, lives with us. She got the COVID vaccine when it first came out, but I'm worried about her getting it again. Can you be too old or too young to get the vaccine, to get vaccinated? Great question, Darcel. I absolutely advise you to have your grandmother vaccinated. That's very important because as she gets older, she is more vulnerable, in fact. And so I wouldn't be concerned about her being too old to get vaccinated. It is still indicated in her age group. And as far as being too young, yes, you can be too young. I think the vaccine is approved for 6 months of age and older. So any infant less than 6 months of age is too young to receive vaccine. But I do encourage your grandmother to get it. I think it's very important so that she can stay protected and not be vulnerable to getting COVID this year. All right, please keep sending me your questions. These are great questions and it's very relevant to the time. So take a look at this video if you forgot how to send me some questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
All right, looks like they're still coming in. Here's another question right now from Zachary. Good afternoon, Dr. Constant. I'm a little concerned about my 5-year-old son because he coughs a lot and for a long time. So how long is too long to have a cough? That's a great question, Zachary. I see this in my office all the time. Parents will say their child's been coughing for 2 weeks, 3 weeks, even a month, but because they don't have any other symptoms, they believe that it's just a cough and maybe they'll just go away. But I just want to remind you that coughing is not normal. It's never normal to cough. Even if you're an asthmatic, you should not have a persistent cough on a daily basis. Maybe you have coughing spurts, and that would be related to maybe an asthma flare-up or having an allergy flare-up or postnasal drip or actually having an illness. But there is never a time where it's normal for you just to have a cough, at least in pediatrics. So I would say if your child is consistently coughing for more than a week and it doesn't seem like it's getting better and it doesn't seem like it's diminishing as far as frequency or intensity, then you should absolutely bring your child to see their pediatrician. And this is because coughs can be for many different reasons. Like I mentioned, postnasal drip, which is where you have a runny nose, but the mucus runs down the back of your throat, can trigger a cough. And so if you have postnasal drip that's triggering this cough, you need to treat your postnasal drip or the cough will continue. And not to forget, having a persistent cough causes throat pain, eventually causes chest pain, headache. So that is not normal. Another reason to have a cough might be a lung issue such as asthma, reactive airway disease, bronchiolitis, and that means that your airways are actually having a spasmodic episode. And so they're spazzing and they're causing you to cough, and it's difficult for the children to breathe. Now, parents expect to see their child gasping for air and unable to breathe, and that's not necessarily the case. Usually by the time that's happening, you're way too far into the illness to do anything. But having bronchospasm, your child might have one symptom, and that one symptom is just a cough, and it could be a periodic cough. And so maybe you think it's not that big of a deal, but in the meantime, the child's lungs are spasming and they are suffering from decreased air entry, and they're also suffering from a little bit of hypoxia, meaning the blood is not getting enough oxygen that they need. So it's certainly worth looking into. Another reason, of course, could be a common cold. It could be a viral illness. It could be walking pneumonia. It could be bacterial pneumonia. These are all things that will cause a cough. And most importantly, sometimes you can have a cough that is not related to the lungs at all. So if you have a child that has a persistent cough and is not wheezing and does not have postnasal drip and doesn't seem to have any illness and they continue coughing, it could actually be cardiac related. So it is very important to have any cough whatsoever checked out by your pediatrician if it's lasting more than a week. Okay, so here is another question. This is from Annabelle. Hello, Dr. Constant. Can you get the flu more than once a season? Our neighbor's son has had the flu last month, and his mom says he has it again. I'd really appreciate your advice. Annabelle, absolutely you can get the flu more than once. Unfortunately, we see this a lot in pediatrics, and the flu season it actually has 2 phases. We see flu season sometime between like the end of September until December, January, and then it dies down for a little bit, and then you have like a February to March-ish, April window where the flu hits again. So some people get it during those 2 times. Sometimes people get flu A and then they turn around and get flu B. There are many different scenarios where you could get the flu, which is why we encourage you to get the flu vaccine, because the flu vaccine actually helps prevent you getting flu A and flu B. So maybe you get flu A, but you won't get flu B. But you definitely want the vaccine to eliminate the risk of getting those two viruses. But those that are not vaccinated definitely have not only a higher chance of getting the flu, but definitely getting it twice because you can get the two different strains. So about the flu, here are some complications that can arise from the flu. First of all, pneumonia is one of the major complications of the flu. And so I just want to clarify that you can't catch pneumonia. Pneumonia is fluid retention in the lungs due to fluid, mucus, and inflammation. And this is a complication from having the flu. So you have influenza has caused an illness, and then your lungs become inflamed. They have a lot of mucus production, and your alveoli get almost obstructed, basically, with this mucus, and therefore you don't have a good oxygen exchange. So your blood is no longer getting good oxygenation by the lungs. And with that said, you have almost a collapse of the lung. So you are having difficulty breathing, you're not oxygenating well, and then of course you have the persistent cough because you're trying to expectorate those big mucus plugs. So pneumonia is a very serious complication of the flu. Ear infections, again, part of the secretions. When you have influenza, you have a lot of secretions being created in the nasal passageways as well as the lungs. When you have increased nasal secretions in pediatrics specifically, because of the shape of the face and the eustachian tube, so that's the tube from your nose to your ear. In children, it is actually almost like a straight shot. So the mucus will drain from the sinuses to the ears and cause ear infection. In adults, our faces have changed and the eustachian tubes are angled upward. So it's a little more difficult to get ear infections, but in pediatrics, the children actually get more mucus plugging in the nose and then immediately drains to the ear, causing ear infections. Sinus infections. Again, from the mucus plugging, increased secretion, staying up in the nose. Little ones are not blowing their nose the way they should. They're not irrigating their nasal passageways the way they should, or they don't let their parents irrigate. They definitely don't want to use a neti pot. So you have all of this retention of mucus up in the sinuses that will eventually cause infection. Dehydration. So you're sick, the children are sick, they don't want to eat, they don't want to drink. They feel miserable, they want to lay in bed all day, they're sleepy all day, and they're not hydrating. Very, very easy to become dehydrated. Not to mention, when we are sick, our basal metabolic rate is increased, right? We're burning a lot of calories. We have high fevers, we're burning calories, we're using energy, and then we're not replacing the fluids. These children get dehydrated. Also, remember, influenza causes vomiting and diarrhea. So if you are vomiting and you are having multiple episodes of diarrhea and not hydrating, overhydrating to keep up, you get dehydrated. So number 5, worsening of chronic conditions. Absolutely. Any child that already has asthma or might have, diabetes or eczema or any chronic medical condition, your immune system is now weakened and you have a flare-up of your condition, and it is worsened by having the flu. Inflammation of the heart, brain, and muscles. So this is basically myocarditis. So when we have a viral illness, any viral illness, but definitely with influenza, the lining of your heart tends to get inflamed, and that causes that is called myocarditis. Of course, meningitis, which is inflammation of the fluid around the brain. Meningitis is absolutely a complication of inflammation in the muscles, especially in pediatrics. So you'll have a child that'll say 2 to 3 weeks after they had the flu that their thigh really hurts, or they're limping at school, or they're feeling a lot of pain, and that is from inflammation in the muscles. So that's myositis. Okay, if anybody has any other questions, definitely send them in. Looks like Veronique has a question. Veronique, beautiful name. That's actually my grandmother's name, who is 97 years old. Dr. Constant, our little girl Chloe is in the 1st grade and just shared with us that a lot of the kids in her class are sneezing and coughing. What are the best practices for keeping children safe in school environments during the flu season? The best practice is keeping them at home. If your child is sneezing or coughing or has any symptoms, please keep them home so that they don't bring their illness to school and infect other children. And if they do infect other children, remember, those children will go ahead and pass it back to your child again. So please keep your child at home when they are symptomatic. And those that are exposed, make sure they are washing their hands and tell them not to share food with their friends and swap drinks and don't put their fingers in their mouth in class. That's the most important. And practice our normal safe precautions. Well, I hope I addressed all of your questions and concerns. I know there's so much to talk about with COVID and flu and rhino and all of the viruses. But I hope I answered your questions, and please, if you have any more questions, just send them in and we can answer on the next segment. Have a great day.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.